There's quite a bit of intriguing progress made in this whole therapeutic realm of ALK inhibition, which is really quite amazing when you consider that it's only 4 to 8% of the population, and yet we have 4 drugs now that clearly have activity. Crizotinib is the first in class. It may not necessarily be the best in class. We know that response rates in those who harbor ALK translocation, EML4 ALK, are in the 60 to 70% range. There's major randomized phase 3 trial that compared crizotinib to standard second-line chemo, either pemetrexed or docetaxel, and in those with the ALK translocation, response rates were 3-fold higher in the range of 60% versus 20%. Progression-free survival was more than double. It was 7.7 months versus 3 months. Probably one of the most promising of the newer second-generation inhibitors includes the Novartis drug, LDK378, where much of the original testing was in the second-line setting in patients who had already been exposed to crizotinib, and there the response rates, at least initially reported, were about 80%. They've dropped down a little bit to 70%, but you're taking a population, many of whom have already received multiple chemo regimens. They've already received crizotinib. They've done well on it perhaps for a while, but their disease progressed, and they're being treated with a second-line ALK inhibitor. We have no analogous situation with EGFR inhibition. Afatinib is the best of the group, and its response rate in this setting is 9 or 10%. And yet, an agent like the LDK drug and now the ARIA drug, and for that matter, the Chugai drug, of all generating response rates that are in high double digits.